Shalom, we are live, TMS RoundTable. It's evening in Israel and it is early morning in Australia. And I'm privileged to be working with my co-host, and here she is.
Morning, everyone.
Good morning, Rose.
Across the world. Good morning, Tova. Good morning, Carla.
Good morning, everybody.
Carla.
Thank you.
Good morning. Thank you for coming. Carla has got a tremendous amount of experience with maternal and child health, early childhood development, and intergenerational trauma, intergenerational pain, and intergenerational, how would you say, Carla, like repair. And one of the wonderful small things that we can offer parents when they come for help is a little program called Sleep Talk for Children, which puts the mother and the father in the driver's seat. Instead of we experts, the mother and the father are the ones driving the story. Anyway, welcome, Carla. Please tell us a little bit about you being in Hong Kong and coming back and your experience, just a little bit personal story a bit.
Sure. Well, good morning, everybody. Yes, I originally am from Australia. I moved to Hong Kong 23 years ago with my husband, and my background is paediatric nursing and midwifery. After a substantial amount of time and moving with my husband to Hong Kong, I started a neurocognitive development program over there. That led me into doing a lot of neurocognitive work and working with primitive reflexes and their attention and their effect on early childhood scaffolding to higher learning. That then led me into hypnotherapy, which I'd been practicing as a midwife for a long while, but formally trained several years ago. That's led me into then the ramification of childhood, emotional resilience and lack of in adult issues that we see, mental health, emotional well-being. And then the beautiful Sleep Talk program was just the little thing that I sort of felt I needed to just help with the emotional resilience with some of the children that I've been working with in family. So I trained with Joan Golding a few years ago now, and have been able to use the practice in my own practice in Hong Kong and around the world because I do a lot of work. So yes, so I have many and varied things that I do, depending on, nothing I do is cookie cutter, and it's really depending on who presents and how they present, and understanding. And I find it very interesting, exciting, and I just think the human body and the whole biology and physiology and emotional well-being of it, I find it fascinating. It's a bit for me like being a detective. I love it.
Very well said. One of the things that we talked about earlier was the whole idea or observation that what happens is one generation has an issue with anxiety, an issue with fear, and it's passed on down to the next generation. And you had a lovely scenario story that you told us. Please share it again with the audience. It was really a lovely story.
With the generation with grandma. So recently I've been finding that I've been drawn more and more to working with autoimmune and the ramification of it, and just sort of pulling that thread back to the original knot. So I've been working with a woman who has been having some issues, and her autoimmune has been diagnosed, misdiagnosed, re-diagnosed, and she's tried to actively be involved in her health process and her emotional well-being, but it's taken its toll. And so 30 years down the track, there's been a lot of things going on with her. Interestingly enough, her daughter also then began to show signs and symptoms of the fibromyalgia, which was presenting in both of them. She working with her, she sort of remembers from around the age of 8 or 9, beginning the tummy aches. And here when you work with both of them individually, you can see the mother was quite fearful that this illness of unknown origin, or this feeling and pain that she was experiencing, there was this concern that, wow, because they're so unknown and everybody's trying to diagnose, we're trying to work out what's going on here, I'm trying to be proactive in my own health. But there's always that tinkering in the back of her mind. Could this be happening with my own child now? And so this belief system starts to evolve, and mum perhaps has started to, through goodwill, check to make sure that this isn't starting to now present in her daughter. The daughter is starting to, as a young child, probably have her own fears and concerns because of what she has seen mirrored to her. This then moves on, so that now the daughter is now a mother herself and has a very little child. And so we've moved into the process of sleep talk, so that we can really build the resilience in the granddaughter and the mother of the daughter. So yeah, that's that's the story you wanted to refer to.
Yes, yeah. Could I just mention, you just said mirrored, and I thought, yes, we mirror, and it's a lovely, like a local sort of word, and it actually, you mirror the anxiety, you mirror the fear.
Yeah.
Yeah.
Absolutely.
And it just goes down. I was thinking about mirrors. And look at a mirror and you see the other mirror and the other mirror and the other mirror, and you can sort of see how intergenerational trauma comes up and anxiety through fear. Not only, like, you might have a family that doesn't cope very well, but that fear is just goes all the way down until someone decides that they're going to pull the plug on it and do something about it. So
as mothers, we are working hard not to do it, and sometimes by not wanting to do it, we do it more. So talk about maybe how you're dealing with the 3 generations and how you're helping them to not try so hard and maybe accept it, or however you would work with them. Can you give us some examples of what you're doing with them, the tools?
So how I work is precisely the mirroring, and also, I mean, it's very difficult to break a generational belief system or thought process if you're not aware of what the alternative is. And I think that's one thing as therapists we all have to be aware of. Sometimes we are very invested and knowledgeable in our craft or theory or therapy, and it can sometimes be for us a matter of fact of what we're trying to present to somebody, and we know sort of the steps and the process, but it can be a very strange new situation. Also, when you're talking to somebody who perhaps presents in the grandmother stage, they've had years and years and years of information, misinformation. It's not through lack of trying. So you often will find that there's a lot of confusion, and there's the fear that comes in with that confusion that this doesn't want to go on to the next generation. And so it becomes very abrasive, and it can affect relationships, and it can affect all sorts of things, because what can be a very, very well meaning thought process of care and love can be perceived by the person receiving it as not letting them find their own way, or not being able to try their own things, and it can become very defeatist. And I think also when people are in a long-term chronic situation of pain, be that emotional or physical, the resilience starts to get worn down. I mean, even if we have a short acute episode of pain, I mean, I hurt my sacroiliac joint on Saturday morning, and it reminded me just how you feel, and I just actually, it was a good reminder that, you know, people live with this for years and years and years, and it really does feel like you can't come up for breath. So for me, well, I'm a hypnotherapist, but I also do a lot of somatic work, and I work kinesiology wise with clients as well. So everything I do is quite multifaceted. I also work with vagal nerve and primal primitive reflexes. So depending on age, stage, and what's presented with, there's various ways. But normally the first thing I did with the grandma or the older woman in the family was a complete mind-body emotional clear of the physical body, because I work very much with cellular memory and that on guard, because it's a little bit like a radio station as I see it, and we tune in and then we program ourselves almost with what we align to. So if you're tuned into a radio station that aligns to a certain thing, and that tuning in can happen from womb, we just tune in, and the tuning in comes with emotion, it comes with hormones, it comes with stresses, fears, and just that primal tuning in of extrauterine life, and it just starts and continues from there as I see it.
Yeah, actually talk about the reflex, the early reflex, because as you were speaking, I thought that's interesting, because often with attachment theory, the child isn't being, the parent isn't able to actually regulate the child. Like it's called a dyad when both are, the child is dependent on the mother. And I thought, you know, when you see that tronic still face experiment and you see the child explode like that, what happens with the child in that context? Because that's a cellular memory, isn't it?
Yeah. Well, we all have these inborn primitive reflexes, which are our survival mechanisms, and we require them for the mechanism of birth. During the mechanism of birth, a lot of them are overridden, and then we build on them for the hierarchy of our learning and cognitive and motor function. So if there is a situation where that is not being able to be exercised and overridden, we can sometimes have hindrances to our cognitive development. And when we have a hindrance to our cognitive development, we are going to have issues, sensorial issues, vestibular issues. And when these occur in the pre-3-year-old, they are going to affect the safety mechanisms or the feeling of what these children cognitively need to do to protect themselves. So if you have a child that perhaps hasn't gone through the process of overriding maybe a moro reflex, that startle reflex, this is a child that may be very much on edge, may not really like that touch relaxation, may be very, very difficult to settle. Maybe they're being stimulated from another situation, maybe some reflux or those colicky things, but it can make it very difficult, and it can make a parent or a mother feel very estranged and find it difficult to settle the baby, and that in itself then starts to put something in the way. And a lot of these reflexes that are retained can be seen in children that are starting to struggle because they haven't been able to move through the predictable sequential cognitive stage of anthropological development. And it does really, you know, continue to have difficulty building up, because this is where we have the sensorial applications and the sensorial integration that doesn't always take place. And of course, you know, the skin and the touch is so important for our emotional well-being as well, that feeling of safety, secure and nurturing.
Yeah, that's true.
And I think that what some of the viewers would want to know is, okay, so we all have these ebbs and flows of childhood, and parents that, you know, all do the best they can.
Yeah.
So how do we evolve into adults? And if we have a deficit, sometimes it'll turn into chronic pain, sometimes it won't.
Well, it probably will. That's
right.
That's why I thought that Carla, coming on the heels of Michael Simone's, reminds us that if we've had early childhood trauma, and it could be a dysfunctional family, it doesn't have to be abuse, it doesn't have to be neglect, it could be just things aren't going right at home. So those milestones that Carla is bringing up aren't being met. So therefore, that deficit is going to remain in the body, and then the body is going to respond by reminding us that there's an emotional deficit being missed, and then we're going to go to chronic pain. Does that sort of
yeah, I mean, I think all of us have a survival mechanism. We're all born and primed that way, and so children, well, it's part of our survival that we learn to adapt to our environment. That's anthropological.
Right. Yeah.
So children will, and babies, newborns, right from womb, will learn to adapt for the safest way possible to integrate into their environment. So what seems to be a perfectly organic development is a survival one, which may not necessarily stand up very well in 10, 20, 3 decades later.
Life. Yeah.
And this is where we have the big issue in the adult life with chronic pain. And also, I heard it coined emotional septicemia, which I just love, and I can't remember who coined it, but it's a beautiful term, isn't it? Emotional septicemia, because I heard it somewhere, and I cannot remember. It's not my because it's a great term, because it just starts. It's just that emotional septicemia, and I guess
mean,
as
like
we start
emotional toxicity. Like toxicity?
Yeah, I mean, it's just it just that weighing down, affecting every area, and it's just that domino knocking on it. And so as we move through life, one thing, then the next thing, then the next thing, so that emotional resilience gets worn down, because you are using these safety mechanisms that perhaps you adopted as a 1 or a 2-year-old. And you're exactly right what you said, Rose. I think we have to really give credit to the fact that childhood trauma does not necessarily mean horrible, awful things. And I think when we realize that it's childhood adaptation, which may not necessarily serve us 3 decades down the track. It was perfectly reasonable choice, and our parents were making perfectly reasonable choices. It's not about getting out to see what happened. People do the best they can with the choices they've got at the time, and we adapt. Humans are amazing like that. It's our survival adaptation. But 30 years down the track, we can sometimes be using survival mechanisms that are null and void and causing all sorts of issues in our relationships, our health, and our general emotional well-being and joy.
And self-esteem as well, And self-esteem is one of those important areas of septicemia.
And that's a key. It's like a key. So it's almost like the work that Rose and I do can be preventative for people. Like it's gonna happen. We're going to evolve. We're going to keep working hard and keep working these tools in our brain. And then at times something like Corona comes up, or something like a divorce comes up, and it's like, I don't have the tools. I don't have the adaptation. It was working, and all of a sudden my body's protecting me with fibromyalgia. So what's almost like bittersweet is the tools that we're learning and that you're talking about, and that Rose and I and the skills are life skills. How do we keep adapting? How do we not blame? How do we take responsibility? How do we feel our feelings, understand our feelings, accept ourselves?
And that's exactly right. It's really stepping into understanding that we are creators of our own experience, and being able to really step into that, and also understand that we are, I call them the hide and seek emotions, because we can't even recognize why we've put them in place. Quite often we've put these feelings or these survival emotions in place way before we even had cognitive language to express what it is. So using a word or trying to understand, I mean, it becomes such a part of our being that it's just our go-to safety place. Completely inappropriate once we're adults, but at the time it was fair and reasonable. We adapted to a survival. However, and it's exactly right. It's seeking, finding them, and they're very, very insidious. They love to encrypt into our cellular memory. They love to encrypt into our emotional DNA almost. So, and that's why I call them the hide and seeks, because they've served us well, and the inner child in us all hold on to them for dear life. We do not want to give them up in a big hurry, because it's encrypted. It's encrypted.
Yeah. Well, the other thing as you were speaking that came to mind is that when you ask patients to go out of that known into the unknown, it's almost like going into outer space, because there's nothing to anchor them without, or align them without some sort of support.
And I think that's something that I speak a lot with my clients, is knowing the difference between being grounded and anchored, because I think grounding is one thing, and I say this to my clients all the time. Are you grounded or are you anchored? Because grounding, you can walk and the earth can feel you, and you can feel that you're resonating and you're part, and your being is being able to move but still feel very, very resilient in the steps that it takes. Anchor is a very different thing. It's being tethered almost. So there can be these movements that feel a little bit one step forward, one step back. So that's something, the language that I like to use with clients as well, to just think about the difference. Does it feel safe and tethered, or does it feel safe and mobile?
Yes. But what I like about that whole idea of being anchored is that when you drop the anchor when there's a storm, you can move around and you're safe. You're not stuck, but you're able to hold on. And often with trauma, it doesn't go away on its own, because you're left with that sort of unknown feeling outside. Yeah.
And I do understand that term, and it is a very important term to use. So I don't mean to discredit it, but
no, it wasn't that. It's just that when you're grounded, you can do it you're alone. But with pain and with trauma, when you're facing the unknown, or like a stormy sea, when you drop anchor, you can still go with the waves, but you know that you've got your anchor down there. That was where I was sort of coming from.
Yeah.
And that was a good explanation, Rose, because just because of perception, and because we have no two snowflakes alike, every fingerprint is different, which is fascinating. So one of our members of TMS RoundTable said, and she has a good point, anchor would feel stuck. For some people, anchoring would feel stuck, and yet anchoring would feel grounding for other people. So you're right, Gail. What do you say to that about the actual word anchor, grounded? I think it's such a personal thing also. So
yeah. And that's exactly right. I mean, everybody, and that's where I got back what I said before. There is no cookie cutter. Everybody perceives things how they perceive them, and everyone's perception of how they perceive themselves is very real, very valid, and needs to be supported accordingly, because it's true. For somebody, it can feel very tethered. For others, it can feel very grounding. So it is the perception in the client individually. Yeah. And that's the beauty of being able to have that, you know, the talk and the conversation, have that language to, there is no one way, there is no one methodology, there is no one theory, and we need to be able to really move in to that understanding that we are responsible, and we have to be, sometimes we have to be very convoluted to get where we need to go, and that's okay. That's okay. Some people can move mountains very quickly, others take longer, and that's all okay.
Right. Right.
It depends also on your trauma and within development, so that if you've had pre-verbal trauma, you don't have a space to actually express it until it becomes open. And that's why I was so interested in that cellular memory and those vestibular issues, because in therapy you notice that there's a lot of vestibular issues as adults, and they don't connect it to their trauma, and they don't connect it to that early development until they come into the room with you, and you start querying them about, you know, different issues, and then you find out that they've got a tight jaw, and they've got tension headaches, and then you ask them about their, you know, ear or whatever, and they'll say, oh, well, I have had tinnitus forever, and you realise that the trauma was probably earlier than speech. Yeah.
Well, also, I mean, these primitive reflexes are the hierarchical order of our cognitive human mechanism and mechanics. So if we're not using them and overriding them and integrating them, it's going to affect our sensory integration, it's going to affect our touch, it's going to affect our auditory and our visuals, it's going to have some of us on high alert, it's going to affect our adrenals and our endocrine system, it's going to affect our ability to, you know, feel comfortable being touched. I mean, we've got all these things now. We've got weighted blankets, and we have havening techniques, and we're having EFT tapping techniques, and all of these things to feed the skin. And we mentioned the other day, you know, LaBoya and his beautiful book, Birth Without Violence, feeding the skin. And it's that, and it's feeding the skin. It's that mechanism of movement. It's the mechanism right from our birth. It's the moving of that wonderful psoas muscle, which is so important to allow posture and just, you know, be open almost. I mean, I see it almost as if we have so many adults and children that are sort of over. It's almost like they've got their spine up to protect them.
Right.
You know, because we're on our back, you know, we've got, you know, we're exposed, the belly could be attacked, you know, very primitive, but it's the way we posturally hold ourselves. Yeah.
And, you know, one of the things that always crosses my mind in this area, especially with chronic pain, is in labour ward. You know, we see mothers trying to deliver their babies, and the pain is so acute. But in hypnobirthing words, it's waves. It's like riding a bicycle up a hill where your muscles are aching. But it becomes excruciating pain. And as a midwife, I've sort of realised that it's so related to early trauma that the body is being attacked, and yet the body is actually doing what it needs to do beautifully, amazingly. Yeah. And, you know, you notice a change of shift, and the mother stops labouring, or she's trying to breastfeed, and someone walks into the room and she can't let her milk down. Right. And that's all related to this early trauma.
Right.
But that's
Carla
another.
has got a lot of anecdotes about that too.
But that's another example of generational,
intergenerational
passing down.
So, Carla, I'm going to interrupt because I know that some of our listeners, you know, they've had years and years of not being able to, I wouldn't say anchor or ground, years and years of just not being able to come to terms with their pain. And, you know, and I have so much hope for these people because I feel like it's just, it's not their life process to be in chronic pain. It's just not normal.
No.
It doesn't mean they're abnormal. It's just, so what are they, like, what, if you've worked with someone who's been chronic pain for many years, you know, 50, 60 years old, and they're learning everything, like my first reaction would be like, are they still in their head and not in their heart? Like why, if they're in their heart, they've got to be able to succeed. But what do you do with the chronic pain people that are so intelligent and so bright and so ready and they're not getting it? Like, what would you say about that? Would it be hypnotherapy? Would it be, what do you suggest?
I mean, I work with, straight away, I do a mind body. It's hypnotherapy, but I don't really, well, I do access the subconscious, but it's a mind body clearing release. And really with hypnotherapy, squeezing and flushing and getting all of that bog and crud that is just built up over the years out, released.
You mean hypnotizing them, like relaxing them in such a way? So you
I don't do it for that one. I don't. It's a very fast and quick moving type of hypno that I do. It's a combination of a whole lot of things that I've sort of worked on over time. My husband has actually a genetic marker for an autoimmune disease, so he's been an amazing guinea pig for me and great learning tool. So, but he's pain free, and you know the thing is he has that genetic marker, so he has a particular autoimmune, but sad for him, but it's been great for me because I've been able to professionally develop it. But so thanks to him. But so I will always do the mind body first, and that's a very rapid transformation, and it's quite interesting when I do that type of hypno. I see years just lift off of people. It's like, and one of the first things they do every time is they'll put their shoulders back and they take a great big breath in, and it's as if the diaphragm and the base of their lungs, it's like there's air going in there for the very first time in a long time. And once you've got that breathing, you're getting that whole nervous system to go, hey, actually I'm alive. And then the rejuvenation can start to take place. Once you've got people out of that place of cellular pain. I mean, it's like if somebody has an amputation, if they have to have a leg removed, 6 months down the track, they still feel that itchy toe, even though it's gone. The nerves need to be reminded that this is okay, we're rejuvenating, we're feeling good and refreshing. And then you can start to move onto the mind. But also, you know, there's diet, but I think the most important thing is that resilience and empowerment to be able to make really positive choices and see those choices making an impact. But that crud in the body, that cellular memory, it has to be released.
You mean the cellular memory? I mean, like the cellular memory.
Yeah.
Wow.
Yeah.
Wow.
Once that's gone, and some of that is, as I said, some of that is from way back, itty bitty baby survival mechanisms that we're not even aware why it's there and what we put it there for.
Right. So here is Gail's response to what you said, because I was pertaining to her. How can one be relieved of chronic pain other than tricking one's brain if it was created by faulty medical procedures?
Oh, so that if it's a faulty medical procedure, there would be another way of going in there. So you would need to, that see, this is where it's no one's the same. So in that case, if it's a medical misadventure that has caused this, there would be some subconscious deeper hypnosis that would need to be done first, and then in that, so yes, it can be done, but it would be done differently in that situation, because it's that's been placed there by a misadventure, so that needs to be addressed and looked at.
Right. Yeah, there would be a lot of anger going on, Rose? And that anger needs to be opened up and allowed to be explored and expressed. So medical misadventure, you've got blame, you've got lack of competency, you've got your good trust has been broken. There's a whole lot of other issues underneath. So fear. They need to be addressed with help usually.
Yeah, but not impossible at all. I don't believe it's
impossible. No.
I mean, even saying out loud, you know, recognizing that you're angry with the misadventure would be such a relief, you know.
Yeah. You know, things can take us in very subtle ways. I mean, for me personally, at the age of 25, I had a third of my liver removed with a very sudden development of a tumour. I went into theatre, and 15 hours later, I came out in intensive care, and my whole life suddenly tipped upside down. So I walked out of there feeling amazing and wonderful because I survived this, and I was told by everybody how lucky I was, and I had a brilliant surgeon, and I was extremely grateful. But it was very interesting because for many, many years, there was something that would cause me some thoughts in my process. And I experienced what I can only say was survivor's guilt, because I remember the surgeon's words to me before I went into theatre were, I have another lady before you, but I think she'll be open and shut. And if she's an open and shut case, I'll be able to do your operation today, because I collapsed at work. It was all very sudden, right? This tumour that presented. And so the nurse came in and gave me the pre-med, and I knew that the woman before me had been an open and shut case. And I was 25 at the time and had just met my husband and was beginning my life. And you know, that didn't really occur to me until probably 4 years ago, because I would have this moment like at my children's birthday parties, and I'd always have these little words in my head that would say, oh, I wonder what would happen if you hadn't have survived that. And yet I had. And I had robust health, but so we can never understand exactly what we're going to what we're going to say to ourselves, what our belief systems are, how we're going to even quantify gratitude and the self-worth of, well, that place of sacrifice. Sorry, I just threw that little story in.
No, it's very interesting.
Perfect. Yeah.
So Mia has a question. Yeah. Can you see her question, Rose? Can you read it?
Yeah. Well, it's very easy for the baby to refuse to drink the mother's milk if the mother isn't letting down and isn't giving you any milk. If the mother can't produce enough milk, the child is going to present as refusal, breast refusal, and that vasovagal response, when the mother draws away, pulls back, the mother has nipple pain. I can't remember what it's called anymore. Nipple pain. What? There's a term for it. The child can't drink the milk because there's none there. Right. Carla, what's your comments, Carla?
Did you see the question, Carla?
Sorry,
here's the question.
No, I didn't see it.
Okay.
Yeah, what's the question?
Since Mia is asking, since you're two midwives, could you talk a bit about when a baby refuses to drink the mother's milk from the breast to a crucial point, like that it's life-threatening, like the baby refuses to the point that it's life-threatening. What do you say to about that?
Well, again, I mean, here we have a lot of belief systems and talk as well. I mean, in an ideal world, you would be able to sit with a mother and let them have the right nutrition and the right rest and the right support. However, that's not always the case. People don't always get that support. And, you know, I had a very interesting, I remember a very wise neonatologist once saying, you know, if we go back over centuries, there were wet nurses and tribal midwives that had milk and the babies were fed and nurtured. I mean, when my children, I had the opposite. I cried and had children failing to thrive, or my first one particularly, who turned 24 yesterday, because I had oversupply. So I remember at the time I had a friend who was crying because she had no supply, and I was crying because I had oversupply. But my poor and I got the midwife pediatric nurse curse because there was my child admitted to hospital as an FTT baby. They called them the failure to thrive baby. So you can imagine, you know, I was like so completely engorged, mastitis 4 times before he was like 6 weeks old, I think, and admitted twice for it with IV antibiotics. So, yeah. So it can be very traumatic the other way as well. Yeah. I mean, you know, again, I think making generalizations, I mean, everybody, and looking at the situation, but I mean, rest, sleep, get some snacks in, and, you know, just feed the babies and let them have that. But, you know, I'm not naive to know that that's not the reality for the modern world. We've got toddlers to run after. We've got work to do. We've got socio-economic situations. I mean, we have to be very open. I mean, we know ideally what things should be and how things can, but we have to be realistic as well. It's very difficult for some people to have that time to sit just with their baby. I mean, it would be beautiful, but it makes it difficult.
But it's the emotional support that's probably the thing that
and again, that's generational as well. It's not always going to come, is it? It's not always going to come.
That's
you're going to have, you're going to have the mother-in-laws and the mothers and the sisters and the aunts and people giving advice, and again, that's that emotional resilience of what do I do? You know, that natural rhythm getting interrupted with the next generation.
I mean, wouldn't it be amazing if we were taught in school, you know, the biology of acceptance, the biology of gratitude, the biology of self-care, you know, like if everyone could just accept the situation and there was everyone was like, okay, I'll keep my opinion to myself. And I was maybe the mother and I'm like, I'm just going to accept the situation and be calm. Thank God there's formula, even though I don't want to give my child formula, you know, I can pump, you know, so there's sort of this acceptance that we don't go there. That's not our go-to. Just accept the situation. It's like to listen to our thoughts and get stress. It's almost like that's the fight or flight. We're back to the fight or flight. Like, I'm scared, I'm wrong, I'm bad, I'm not good enough.
I think also we underestimate the value of good nutrition. I mean, I really believe that is so important, psychonutrition, because most of us are having a nutritionally bankrupt diet. Even as much as we try and think we're doing well, there are the vital minerals and elements that just aren't there, and they can make you feel a whole lot better really, really quick. I mean, I'm not a dietitian, but again, use my husband as a guinea pig, and have realized the value of making sure that we really check in and give ourselves the vitamins and minerals we need, because that too is very important for our emotional well-being, rejuvenation, and just our zest. And zest is important. Zest is really important for that vitality.
So true.
Yeah. All of those things make a whole human being, really.
Yeah, so multifaceted.
Yeah, and also that whole notion of work, what do you call it? Work, rest and play. 8 hours work, 8 hours rest, 8 hours relaxation. This, in the modern world, that doesn't happen either. 100 years ago, workers went on strike to stop having 12 and 14-hour days. Now, I know in hospital now, the staff do 12-hour days. Some of the doctors do 24-hour days or more.
Yeah,
they can have to work,
and more.
Yeah, 48 hours before they get a break. And, they're not able to make good decisions under that sort of pressure. So when it comes to intergenerational trauma, it's going to be exacerbated. Sorry, go ahead.
No, I just, when you mentioned that, I was reading something the other day, and I think it's becoming, perhaps it's going to be a little bit more mainstream soon, maybe, is it Circadian Rhythm? Do you know? Have you heard of? Yeah. So getting in tune with all of that again, depending on who you are. Yeah. That's
Yeah. Well, the melatonin at dusk, we secrete it, I think, from our pituitary, from memory, and that helps us to wind down. So with all our bright lights and our cities, we're not able to achieve that. And like 100 years ago, they probably had little lamps and things, so the lighting was lower. And now, of course, we have LED lighting and the whole.
Talking about adaptation, the people in Sweden and Finland adapt to a different set of lights, a time of lights, and the people in Alaska adapt to the weather. And I think that's the other end of the adaptation and the
well, that's the melatonin that can come down. But remember, Finland is the home of depression. What's it called? Winter depression or something? I can't remember now.
No, they call it. There's a name for when we're affected by weather.
The weather.
Affected by weather.
And of course, Finland is low lying, and I suppose damp or whatever. I don't know. Yeah. And it's known as from those long nights that
I have some close Finnish friends. I'll have to ask them about
that.
They'll watch this part. They'll watch this replay and they'll give me that.
Maybe it's called seasonal sensitivity or something.
Seasonal sensitivity. Seasonal depression. Yeah, that's it. Yeah.
But Carla, share with us. Besides the hypnotherapy, which was, again, many people, hypnotherapy is just a really good, solid practice of meditation and being mindful and being aware and then we're back to self-love, self-care. I mean, we interviewed a woman back in the beginning, a wonderful doctor who, she's a dentist, but she was enormous amount of chronic pain and had surgery, and then realized that she just didn't love herself. She didn't take care of herself. And she wrote a book. Her name is Dr. Sunita Merriman. She wrote a book called Stripping, Finding Yourself. And she was just so beautiful. And she has this website, and her blog is Self-Care, Self-Love. And it's just almost like too simple. What do you mean I have to care about myself and love myself and regulate myself and accept myself to be healthy? Like, can you talk about that a bit? Because that's really the freedom. That's really the way to get out of the cave.
Well, again, it's the words we've been told, we tell ourselves. The behavior that has been modeled to us, we believe is a way to be. And so often we come to adulthood telling ourselves words about ourselves that don't belong, taking a behavior or taking a way of handling or working with a situation that isn't authentic to how we should work with it. But it's the tools in our toolbox that we've been presented with. Well, actually, no, they're not what we've been presented with, but they're what we've been given and we've acquired. And so this self-love and finding and understanding and stripping, which is a wonderful term, gets you back to your basic toolbox, yourself. And again, I mean, this is where the sleep talk and right back in the early childhood, it's the emotional resilience. It's the emotional resilience of I belong. I have the right to be loved and lovable, and I have the right to be authentic in my belief systems. And that alone just takes away a lot of frustration, a lot of confusion, because a lot of us are in situations which it's like there's an itch, but we don't know how to scratch it.
Well said. Carla, you've just brought up that whole idea of being lovable. And that's the lovely thing about that sleep talk thing. It allows the child to be lovable, even if they're not terribly lovable for the day. Even if the child has had a behavior that upsets the parent actually has to admit that the child is lovable, despite all the things that go on. And as far as attachment theory goes, what Joan Goulding came up with meets John Bowlby, Mary Ainsworth, Mary Main, all the psychologists and psychiatrists who have developed attachment theory. Joan Goulding actually hooked in without knowing that she met all that criteria. And basically it creates a moment when the parent has to let go of their annoyance and remind themselves, not the child, but themselves, that their child is lovable. It's so amazing, and the difference that it changes and that it takes in the parent when they can say that unequivocally to that child that they've told off during the day, and then at night they're able to say, you are lovable. It's a really profound attachment bond again.
And the beautiful part of it, they're not just saying that to their child, they're saying it to themselves.
That's right.
Right. So can't we at this sleep talk program do as adults talk to ourselves as adults and tell ourselves each night?
Well, because we've tuned in our radio to I mean, a lot of adults do have a belief system of resilience, that they are lovable, and that's fantastic. But the sleep talk itself is really designed for that beautiful, powerful parenting ability to be able to get in touch and, you know, get your child tuned in to that station of I'm lovable, I'm worthwhile, and I'm here, and I'm going to have a great life. It's so simple. It's unbelievable how simple it is. I mean, that's the thing. When I started out to do my training with Joan, and I was thinking, oh, you know, and is that it? But it's so beautiful. The simplicity of it is beautiful, and I think that's the wonderful thing. I mean, none of this is rocket science, really, but we can put it under theories and back it up, and that's all. I'm not discarding any of that, but sleep talk is beautiful. I mean, I just admire Joan so much. I'm so grateful for what she's brought to the world, because it's really touched the lives of thousands of families, children, and it really is a beautiful program. And even, you know, the children who, I mean, I used it on 2 of mine when I was doing my training, who I didn't really even, I thought, oh, well, I'll do it because it's and it's incredible the difference it makes. And you don't, you know, these are with kids that you think, well, you know, I'll give it I've got to get, you know, a case study done. Really, that's how I went into it. And you still see a difference. It's a marvelous, marvelous, wonderful thing, and such a gift we can give our children. I love how she calls it an emotional hug, and that's exactly what it is. It's an emotional hug, and it's a gift you give for a lifetime. I mean, if we look back, and I mean, that's one of the first things she said to me when I did my training with her was, well, go back to childhood. Can you say you felt loved? Wow, what a confronting word. What a confronting thing.
Yeah.
Because you actually then have to go, and that's a big thing as an adult when you don't perceive that anything was off kilter, to actually go, well, hang on a minute. It's fine, we can accept that our parents did the very best they could, but was that always helping our emotional resilience?
That's right.
That's the missing link, isn't it? And so being able to know that you can give your child, as she calls it, that emotional hug, the gift that keeps giving them, that they can really pull on that in all aspects of their adult life. It's very gentle but so powerful. And I've seen it in my own 2 daughters, how powerful it is. And the countless children that I've worked with in families.
The other thing is that, as you were speaking, called to mind was that, you know, we need to show our children what they need to do. And I was thinking about a muscle. When you use a muscle, it becomes disintegrated, and then it has to repair. Emotionally, we can repair that, you know, like, don't spill your milk type of thing. When the child thinks, well, I'm not good enough, I'll spill my milk. But at night, then the parent reminds the child that they're lovable, and the milk problem just goes out the door. It's just not relevant. And one of the things I noticed with one of my grandchildren was he likes basketball, but he was finding that he was hesitating. So early teen, and he came up with the idea of having a little talk when he was asleep about hesitation, and it built his confidence. I mean, it's so simple.
It's so simple. And I mean, I think that the key that you said as well, I mean, whatever happens during the day, and that's the interesting thing about parenting, isn't it? I mean, I found myself with our 4, you know, we parent our kids with how we were parented. You know, we model parenting. That's how we do parenting. It's how we were taught parenting. And you know, so my husband was parented very differently to how I was parented, and the kids get a mixture of how we think parenting should be done. Now, some of that's good, some of it's really, really bad. But again, a lot of it's
very bad.
But at night when they're asleep, you know, you're right. I mean, all of that just sort of dissolves, and you can tune the radio station in to the resilience channel, which is
lovable. I am lovable.
What I love about what you're saying, think about this. Stay with me on this one. Okay, so when we're little, a negative thing happens, and then we override it with this positive, like, feeling, and hopefully the child will focus on the positive. So it's almost like there's these 2 pathways, you know, negative things and positive things. Yeah. So what hopefully we're doing scientifically and emotionally with chronic pain patients is saying you have this pathway of a negative experience and chronic pain and betrayal and anger, and I'm trying to have you have an experience of love, whether it's in the therapy room, or whether it's from loving yourself, whether it's from taking yourself out to do something nice, self-care. And so we're trying again as an adult to, Rose and I were having a deep conversation about learning a new habit or understanding a new pathway or adapting in a healthier way. Rose, talk to Carla a little bit about what we were talking about and sort of how
I was saying it's not about learning a new habit.
Right.
It's about observing an old habit that doesn't work anymore.
Yes.
That's all you need to do, observe.
Right.
But with bringing Carla on and actually noticing that we can change, that we don't have to hand on that pain is so wonderful.
Yes.
That we can have that pain-free child because their anxiety has been wiped away, because they know that they're anchored with you, that you are their safe place. Because, as teenagers, Bessel van der Kolk has, I think it was Bessel, Gabor Mate has written a beautiful book about keeping your child anchored to you through their teenage years and not encouraging them to have friends or not encouraging them to go out and see the world, but allow them to see the world through your eyes in a safe way. I can't remember the name of the book now, but it reminds us that as adolescents, until we're sort of like well into our teens, we still need that safety of our parents. But we can't trust our parents because they've got their own issues. And that's why if they've been anchored with that sleep talk program, they know they can tell their parents things that aren't necessarily politically correct. And I think and that's a wonderful thing about it. Sorry.
It allows also, I mean, to be independent, you have to have experienced dependence on all levels.
Of dependence, yes.
So
precisely.
Kicking, like kicking a child out the nest before they have experienced complete dependence for their nutrition, complete dependence for their emotional needs, complete dependence for their physical needs, complete dependence for their academic and lifelong and relationship needs. That complete dependence has to complete that gestational cycle before independence and then can come about, because otherwise we are expecting them to face and do things without all the tools available. And it's their right to have that nurturing and that care and that safe and that love. And what I love about sleep talk is, as you mentioned, no matter what happens during the day, no matter how wired the child is and the parent is and what's going on in the chaos of life, they are asleep. And it's those, again, and tuning in to that radio station of calm, peace, very clear words, a clear understanding of being completely accepted in that moment. And that's going to just trickle. It's going to trickle into the endocrine, the adrenal system, the nerves, the cells, the muscles. And so that feeling of peace and calm.
So it's chemical. It's chemical. It's a chemical
reaction. Absolutely. So with that coming out, we hopefully will see less and less emotional septicemia.
Very
because
good.
that on guard, the on guard.
A tool.
That's so many.
I always like our listeners to take home tools. This is where the biology of hope, the biology of gratitude, the biology of self-acceptance. When I feel love, my brain calms down. Different chemicals secrete in my blood. I don't have to be meditating or sitting and doing yoga. I could just be, everything is going to be okay. You're okay.
Yeah.
Tomorrow's another day.
Yeah, it's breathing. I mean, and meditation can happen when you're running fast. Meditation can happen when you're riding a bike fast. Meditation can happen when you're washing dishes or knitting. And I think that needs to be reminded, because I think a lot of people think, I can't do it. And they're wired. They're full of reflex that just wants them to run. And with hypnosis as well. I mean, you know, a lot of people will come to me and I've tried meditation, it doesn't work. And it gets to that place and often it will boot you out. Your subconscious will boot you out. It's protecting you. It's protecting you.
Wow.
So being present in the present, the minute you get to that cusp of the subconscious, it will boot you out. So yes, you can go into hypnosis with a meditative state, but you get to that cusp unless you're doing self-hypnosis, which is an easy tool to learn, but often that meditation, it will put people into a fight-flight, and I have found in my experience, and it's just mine, that clients that come to me with severe anxiety, insomnia, or trauma, you know, they do not even like to do that because it wires them. And, you know, I'll often say, you know, go running, go swimming, go for a fast walk. Yeah. That is still meditation because you're discharging the energy. The energy has to be discharged. It's letting the energy move through you, the thoughts, the feelings, the emotions, rather than stuck in the cells. And a lot of that does is just have you breathing. The minute that breath hits the bottom of your lungs, stimulates your diaphragm, your vagus nerve says, oh, I'm alive. It's Beautiful. Just reminding you you're alive. Beautiful. So it's taking a big breath.
Can I just put a little word in there? People with anxiety breathe in the upper part of their lungs. So unfortunately, they don't get that I'm alive feeling because they're on the run all the time. So they're breathing up here instead of down there. So when they breathe down there, their diaphragm operates. Now, that's also the change area where our myelinated system finishes and our unmyelinated system arises or is there. So this is that I'm alive thing that Carla's talking about. As the air goes down and oxygenates the lung and the diaphragm, the breathing happens from the diaphragm, well then that connection comes from our millions of years of being human. It all comes together in a way of being alive. Actually, there was
excellent
song,
tool.
Isn't there? Yeah.
Excellent tool. It's just
anyway. And it activates our phrenic nerve and our vagus nerve. And interestingly enough, if you look at a toddler, the way they walk, if you look at the way a toddler positions themselves, they have their shoulders back, they have their chest out. They've got that staggered gait, and toddlers know how to breathe. Toddlers are like, I'm alive.
Whoa. Yes, and the world revolves around them. The world revolves around them.
Exactly. Exactly. They come into this world expecting to be fed, loved, and have a great time.
Yeah, exactly. Are there any more questions?
I don't see any more, but I see some people coming in and out of the Facebook page, and so people have been shy, and they sometimes ask questions afterwards. And so, Rose, let's remind people they're more than welcome to ask questions afterwards. Carla is in touch with our site, and Rose and I am always available. Janet just came on. Let's hear her question from Australia. When you are mainly wheelchair bound and cannot exercise, walk, or run, or swim, or anything that raises the heartbeat for any length of time, how do you release? Good question, Janet.
I think anything, kiddos, like knitting, tapping, playing a musical instrument if you have one, singing is beautiful, humming humming, anything that's going to, you know,
hum. That's what Patty just says. Yeah.
Singing
what about
and humming.
Visualizing? Is that positive to visualize and just sort of?
Well, I'm sure it is, but I think if you want to get that, the breath work, and if you want to discharge and get that feel good vitality, you know, wake up the cells. So humming, singing, laughing,
Patty,
gargling, anything.
Patty Clark has an answer. I read somewhere where if you gargle or hum, it helps your vagus nerve.
Yeah.
Or a cold shower, maybe we could calm and be able to breathe. So Janet, and I'm going to say, as a chiropractor, sitting up straight in your chair, Janet, and lifting the chest, like I call it Pilates, sitting and doing Pilates will increase, all the muscles will be elongated, and you'll have like a beautiful tunnel of love, to breathe. So don't ever give up, because Rose and I will always have an answer.
Oh, Janet does hum and sing. Oh, very good.
Yeah. Oh, Janet says she does hum and sing, and that's amazing. Could you tape it, Janet? We want to hear you. We're going to put it on our YouTube channel, please. Singing is so important. Singing and dance, all that is very, very good. Beautiful work. Beautiful answers. So I love that some new people came in at the end. So I'll say it again. So as we end up, sometimes we say goodbye, and then a few more people show up because they come out of they start humming and singing. So I'm so thrilled. Interesting.
Start a choir.
Amazing, a choir.
Yeah. Carla, if you have a look on the thingo and respond to people as well on the Facebook page.
Yeah. Okay.
You can do that. Carla and I have got the day ahead of us.
Yeah.
All of us in Australia. But
maybe Carla, you could write a little thing about if somebody wanted to learn to self-hypnotize or self-relax or self-regulate. Maybe there's something you recommend, because we're all working on self-calming, self-regulate. I mean, going on a bike, doing this. But someone like Janet, for example, would have to be able to calm her nervous system down on her own. Maybe you can share that on the Facebook page. So appreciate having you. Rose, want to say goodbye?
Carla, yes, it's just wonderful. I hope that our audience enjoyed your stories. I certainly did. And it reminded me of just how important child development is and how we can break the cycle. And that's the whole idea, that we can break the cycle.
Yeah.
We don't have to hand on our fibromyalgia, our tummy pains, our migraines. They can stay in the past and never be sent down the line to the next generation.
Right.
So thank you all for being here, and thank you, Carla.
Thank you for having me. Thank you for having me.
Yes. Have a great day. Good night, everyone. Good morning. So happy to meet you all. See you soon.
Bye-bye. Thank you.
Bye.
Okay.